Welcome to Collab Conversations with the American Diabetes Association and Beyond Type 1. My name is Ginger Vieira, and with me today is Dr. Cynthia Munoz from the ADA. She is President of Healthcare and Education, and we're going to pick her brain today about diabetes denial. Hi, Dr. Munoz.
Hi, Ginger. It's a pleasure to be here. And oftentimes, when we talk about denial, it really is, people that may be experiencing some difficulty in understanding that their loved one truly has, diabetes, type 2 diabetes, or understanding or believing that they have it. It happens a lot because the things that people oftentimes think about when they think about type 2 diabetes are not necessarily true.
Right.
A lot of people think people with type 2 diabetes, might look a certain way, or that there might be certain things that are true about them, like, the things that they eat or the experiences that they've had. And that's also not always true. So I think diabetes is really complicated, and that contributes to the difficulty of understanding how one may have that diagnosis.
Even I would imagine what people think they ought to feel like if they really had diabetes. They could feel fine, right? Because they've gotten used to their blood sugars running higher. So it would be hard to believe that there's something wrong.
And, the other thing, Ginger, are sometimes there are health beliefs that are more common in different cultures.
Right.
So in some cultures, there's a lot of blame and shame and guilt around learning that you or your loved one has diabetes, because you think it means that someone has done something wrong,
right,
or you think that someone has experienced a traumatic event that led to that diagnosis. So it's really interesting. And then there are other beliefs around lunar eclipses and other things that may lead to a diagnosis of diabetes. And this is why it's really important to have that conversation with a medical professional around, what this really means and why.
So what is the first step to helping either yourself or someone you love address that they do have diabetes and they need to kind of grasp that and accept it? How do you get past denial?
I think the first step is really understanding what it means to have diabetes. Okay. So let's say we're talking about type 2 diabetes, and you have been told that you have type 2 diabetes, or you have been told that your loved one has type 2 diabetes. If you find yourself wondering, how is that possible? Or do I or does my loved one really have type 2 diabetes? I would start by asking more questions. What does it mean that I have type 2 diabetes? How did you determine that I have type 2 diabetes? Right. Or how do you know that my loved one has type 2 diabetes? But by better understanding how the professional in front of you who's telling you you have this diagnosis or that your loved one does, asking lots of questions until you understand what having type 2 diabetes means. Okay. Then I think it is about taking a breath and sitting back and giving yourself time to think about what that professional has explained, and how that might be true for you or for your loved one.
Okay. So, even just really asking to see the results from your blood work, your A1C and your blood sugar level, your fasting blood sugar, and looking, ask your healthcare professional to show you what is a non-diabetic normal blood sugar level goal and what is my blood sugar level that indicates I have diabetes, to really see those numbers.
Yeah, absolutely. Now I don't know about you, Ginger, but I know I've been to doctors that, have a little whiteboard or a piece of paper, and they'll draw pictures. So yeah, I really like that idea of help me literally see the picture or the piece of paper that shows me that your definition of type 2 diabetes is true for me, by showing me the number. How does my number compare to, you know, the numbers for people that don't have diabetes? And, or how has my number changed over time? You told me before that I don't have type 2 diabetes and now I do.
Right.
You know, what's happened?
Right. Okay. Okay. And then I would imagine some people have learned from misinformation that the kind of the doom and gloom of diabetes that you and I know isn't necessarily true, that there's so much we can do to be healthy with any type of diabetes. Is the next step to really realize that now you have information and now you can find the right tools to help you live well with diabetes?
Yeah, absolutely. You bring up a really good point where oftentimes when people are told that they have diabetes, type 2 diabetes, they imagine the worst,
Right.
either because they've heard stories or they've never really had to think about diabetes and what it means. And you imagine that, you know, professionals telling me that something is wrong with my body or my body isn't working the way that it's supposed to. And that must mean something is really wrong. I do think that once you understand, you know, what diabetes means and why the professional is telling you that you have this medical diagnosis, the next step really is looking at what can I now do based on this information?
Right. What can I do?
Because we know that people with all types of diabetes can live full, healthy lives.
Right.
And can be productive and can do all the things that they wanted to do before they got this diagnosis. But it is new information. Having new information can be overwhelming. And because it's new information, it requires any of us to, you know, to take time to get more information to really understand what it all means and what we can do about it.
Well, thank you so much for helping us talk about diabetes denial and how to move forward.
My pleasure, Ginger.